Hello everyone, this is Srikanti, and today's presentation will offer a broad overview of abnormal psychology, which is the study of the mental disorders and maladaptive behavior. Now, this field helps us understand, diagnose, and treat treat mental health conditions that affect a person's thinking, feeling, and behavior. We will also explore how our understanding of our mental illnesses have evolved and the major theoretical perspectives, the types of disorders, and the various approaches to treatment. It's important to approach this topic with more compassion and openness because mental health affects everybody directly or indirectly. So yeah, let's get started. Now, throughout this history, explanations for mental illnesses have shifted drastically. In ancient and medieval times, abnormal behavior was often seen as a result of supernatural forces like possession or curses. Now, treatments included exorcisms, bloodletting, and even imprisonment. Now, fortunately, over time, the medical model emerged so this model views mental illnesses as a result of biological or psychological dysfunction, which emphasizes scientific and humane treatment. Now, this shift laid the foundation for modern psychiatry, which allows them to diagnose, to also do medication and therapy to replace fear and superstition. Now, there are two dominant perspectives that guide how psychologists and clinicians understand mental illnesses today. Now, now this biological perspective looks at genetics, brain chemistry, and even the nervous system. It emphasizes that many disorders are linked to neurological imbalances or physical conditions, and it supports treatments like medication and brain stimulation. Now, the psychological perspective focuses more on the emotions, thoughts, and behavior patterns. It explores how trauma, stress, relationships, and learned behaviors contribute to disorders, and it favors interventions like cognitive, behavioral therapy and talk therapy. Now, most treatments today involves an integration of both perspectives to give a more fuller, more accurate understanding of each individual. Now, biological conditions significantly influence the mental health. For example, degenerative diseases like the Alzheimer's or the Parkinson's can lead to memory loss, mood changes, or cognitive decline. Now, cardiovascular problems are linked to depression and anxiety, often due to chronic stress or reduced brain oxygenation. Now, and another example would be trauma, especially in the brain injuries, can lead to PTSD, or it's basically a stress disorder. It's also known as post traumatic disorder or anxiety disorders by disrupting the brain's ability to regulate emotions. Now, understanding the biological root of a condition allows for a more targeted and effective treatment, often combining medication with supportive care. Now, let's understand the substance related disorders. Now, substance related disorders are among the most common and the challenging mental health issues. Now, these include the misuse of alcohol, prescription medications, or illicit drugs. Now, substance abuse doesn't just affect the body, it also damages the mental health. For instance, long term use can lead to depression, paranoia, aggression, or even worsening of the pre existing conditions like anxiety or bipolar disorder. Now, substance use often creates a vicious cycle, like individuals may use substances to cope up with mental illness, which in turn worsens their symptoms and complicates a recovery. Treatment must therefore address both the addiction and the underlying mental health concerns. Now, we will move on to the common mental disorders. Now, this slide introduces some of the commonly diagnosed mental health disorders, which includes depression. So, depression involves the persistent sadness, loss of interest, and low energy. Now, this can be due to experiences, especially the traumatic ones. Next, we are moving on to the panic disorder. So, it often features sudden or intense episodes of fear and physical symptoms like a racing heart. Then we are moving to the obsessive compulsive disorder, which is also commonly known as OCD. Now, this involves the intrusive thoughts, or they're called as obsessions, and repetitive behaviors, which are called as compulsions. Now we are moving on to the bipolar disorder. Now, bipolar disorder alternates between the episodes of mania, which also means the elevated mood and energy, and it also goes through the depression. Now, all these disorders disrupt the daily functioning, relationships, and the quality of life. Now, early diagnosis, therapy, and medication and support systems are the key in managing these conditions every day. Now, personality disorders. Now, personality disorders are chronic and deeply ingrained patterns of behavior that impair a person's ability to function in relationships and society. Now, they are grouped into three clusters. Now, cluster A, odd or eccentric behaviors. For example, paranoid or schizoid personality. Cluster B, dramatic or erratic behaviors. For example, borderline, narcissistic, or antisocial personality. Last but not the least, cluster C, anxious or fearful behaviors. For example, avoidant or dependent personality. Now, personal disorders are often misunderstood and they require careful diagnosis and a long term treatment plan, often involving the psychotherapy and sometimes even medication. Now, we will move on to the psychotic disorders. Now, psychotic disorders involve a break from reality, often making daily life extremely difficult. Now, schizophrenia is marked by hallucinations, delusions, and even disorganized thinking, and also emotional flatness. Now, schizoaffective disorder combines symptoms of schizophrenia with mood disorder elements like depression or mania. Now, treatments often include antipsychotic medications, therapy, and even support services. Because these disorders are complex and long term, care must be individualized and consistent, even not just to manage symptoms, but also to support the person's functioning and dignity. Now, approaches to treatment. Now, treating mental illnesses involves multiple components working together. Firstly, assessment. Now, this includes interviews, psychological tests, and even sometimes medical evaluations to understand the person's symptoms and background. Second step, psychotherapy. Various forms of therapy like CBT or psychodynamic or group therapy can help individuals understand and manage their thoughts and behaviors. Third, biomedical approaches. Now, these include the medication, brain simulation, and therapies, and even hospitalization if needed. Fourth, communicative support. Now, rehabilitation programs, peer support, and even family education are essential to long-term recovery. Now, these are all just options to for treatment. Now, the best outcomes often come from a multidisciplinary approach that blends with clinical care and social and emotional support. And yeah, now whatever I have just talked about, now this is just like a basic lesson of the abnormal psychology. So there are more videos in other channels where you guys can watch in more deeper disorders. And yeah, that's it for this video, and thank you for watching and have a nice day. Bye.